better with a difference. Patient awareness talk by our experts in the field of rheumatology, clinical immunology, allergy and reproductive immunology.
In the wave of Pain Awareness Month, in the month of September, Chandra and its team had discussed about various aspects of chronic pain and how we manage them. But we all know that living with arthritis is not always easy. The symptoms are very varied, there are various different causes for it, and there are various different ways how we can manage it. So with this in mind, today our consultants, Dr. Chandrasekhar and Dr. Praveen, are going to discuss about how you can manage your chronic pain or various aspects of different pain in your day-to-day life. We're going to start with Dr. Chandrasekhar sir. Sir, we know that if there is somebody who is already been diagnosed with arthritis, is being started on medicines, his pain has been decently controlled for some time, and suddenly one day he suddenly has increased pain. So what are the things he should look for when he should consult the doctor, or when you think that he can just manage with some pain relief and manage his pain on his own at home?
See, the worsening of the pain is very limited. I just say 10 to 20% of what is his basic pain. He need not really get panic. He need to think himself that is it a manageable pain by himself. One of the possibilities sometimes the pain may become worse is, one, he might have exerted himself on 1 or 2 days before, or he might have forgotten the pill that he is supposed to take at night, or there is a possibility he might have strained the joint or the place where it is painful. Or sometimes the disease itself is, as we know in the beginning, or sometime in between, it has ups and down swings. So in one of it upswings, it might have caused the pain. So usually most of the time when we prescribe, we always tell the patient to manage the painkillers, pain relievers on a SOS basis. That whenever the pain worsens, we ask him to take the painkillers. He can take, we prefer them to be with paracetamol, dry paracetamol or tie sprays. Try to splint the areas. You can use heat pad or cold pad depending on the area where it is painful. Or if the pain is so diffuse and so complete, and then they can use some simple pain relievers, paracetamol. Much more so sometimes just a good stretching, good exercise, especially when you wake up with a little bit pain in the morning, a little bit of stretches of the respective joints or respective pain can relieve the pains. But if it is too much, sometimes you may have to contact the doctor. But more often we suggest you can take a self-care. You need to little bit think about that, what would have worsened the pain.
Sure. So next question is Dr. Praveen sir. So a lot of our patients come in and ask us, we give them so many medicines, and mainly their mind is whether it causes side effect. So how you can explain to them so that this doubt is cleared off their mind about the side effects of the medicines?
It's one of the most people will fear about the allopathic medication side effect, and that's the reason they opt out for Ayurvedic and other medications. So definitely there are side effects, but those are not very serious side effects. Usually reversible with stoppage of the medication. That's the reason we do the routine test every 2 months or 3 months once. So majority, almost 95 to 99% of the side effects which are related to drugs are reversible, and it will stop as the drugs has been stopped. So patient will usually have this gastrointestinal intolerance, which is a gastric related, what we call gastritis or gastrointestinal intolerance, which will improve with PPIs, and other they will be related to the liver, so which are very reversible. So I don't think those are the very serious side effects.
Dr. Chandrasekhar sir, we know that in arthritis patient, early morning stiffness is very common. But we also know that most of the work is done in the morning, like either getting up and going to work or doing the home activities in the morning. So if somebody has early morning stiffness, so how can they manage their stiffness with their daily activities?
Stiffness is a part of this inflammatory arthritis. Whenever there is inflammation, the joints become stiff. the easiest way to get out of the stiffness is to move those particular joints. Quite often, everybody in their day-to-day experience might have seen when they suffer from this type of arthritis, when they get up in the morning, things are stiff. As they move towards the afternoon or evening, the stiffness comes down. It's a simple logic for anyone to understand that if you move the joint, stiffness goes. Same logic applies when you get a stiffness which is really bothering you. Start moving the joints which is causing that stiffness. No doubt, when the pain is too high in the very beginning of the disease, when no medicines are available or no medicines they are taking, stiffness may be so bad, with the pain so bad, even it may be difficult to move the very joint actually. So that could be the extent of stiffness. I am not saying at that point you can move it yourself. Even if not possible to move it yourself, take the help of your partner, take the help of your people at home to helping them to move your joints slowly. So what we normally recommend is someone can slowly mobilize the joints or the parts which are stiff and painful. Once they start moving, the stiffness starts slowly getting rid of, and then you spontaneously move it yourself, and slowly when you move, the stiffness goes off. So the best answer for the stiffness, more than the pain relievers or more than the medication, is the movement, exercise. Move the joint which is otherwise becoming stiff. We need to allay the fear that it is not a broken bone or a traumatized or a injured part. So in an injured part, pain, stiffness is to control and repair the process. Here there is no such damages. So there is nothing bad is going to happen if you move it against the stiffness. I mean, that point should be clear to us in the mind, that moving against stiffness is not going to harm. So see, often what happens is when there is a pain, even the person who sees the patient or sees the individual, we are afraid that if I move that joint, it may become more painful, it may cause more trouble or more problem to the patient. I mean, that fear comes into our mind. I mean, since we are medical person, we think that it's not. Probably, maybe if we are not medical, we would have still be thinking anything which is painful should not be moved. I mean, so that common sense is not applicable in these things. Actually, the common sense should be with the best thought process. So the stiffness is a part of the disease, and the stiffness is not protective in this condition, unlike a fracture or a broken bone. Here we should move the bones, move the joints, either actively or passively. Initially, if there is too much of pain, passively it should be moved by the people at home, followed by someone or himself moving that particular joint. That really helps the stiffness to overcome. In addition, sometimes plain paracetamol or a plain painkiller also help to get rid of the stiffness, but best is to work without that if it is possible.
Dr. Praveen sir, so we know that life is not always the same. The days are not always the same. Some days there are days which are quiet, but some days they are very busy. So how can the arthritis patient cope with sudden work at home, either at home or at work? How can they manage it?
Yeah, with the sudden work, what they have to do is at least with half an hour, 1 hour of the excessive work, they have to take a rest for 10 minutes of duration, with which the symptoms again eases. So they have to take a regular gaps between the excessive work, and along with that, what the sir has told, like early morning, whenever they get up in early morning, they have to do free flexible exercises, which should be the routine, as a part of their routine life, along with keeping the hands in a salt water and the legs in salt water. As soon as they get up in the early morning, also the next day, whenever they do these sort of exercises, that will ease the early morning stiffness and the pain. So that should be kept in their mind, that they have to take a regular sort of snap between the activities.
So actually, I think just to add to what Praveen was saying is that actually you should plan the work. I mean, that's what he was trying to tell it in a nutshell. So see, for example, it's not that you have to always continuously work. You need to really plan the work. Say at office, there will always be a gap. So if you are a senior, probably you have much more flexibility. You can always tell that this, that. But when you are a little more on a person, to make the senior to understand that you have this point, and you will be able to work with it. And you need to plan how you will work with it. And simple stretches, especially in an IT professions, as in the people with ankylosing spondylitis, we see them when they sit for a longer time in front of the computer, the whole back becomes stiff. So how to manage that? See, manages, you have to plan your work. I understand in a big office, of course, not to work from home. So if you are work from home or you are at the office, if you sit continuously in one place, back becomes stiff. So take a small break of 5 minutes, walk around the office without disturbing, of course, the other colleagues, and make some simple stretches, going to a restroom or going to the room. I think nowadays in very good IT firms, they provide gym and space for stretch. Do those stretches and come back and sit and continue to work. Otherwise, sometimes what happens is when you are sitting in one position, it may become stiff. So you have a long hours of work. You have to do that. And other job is a long hour of physical activity. So there also it may cause pain. So at that time, take small rests, small gaps. It's always you have to plan out the work and try to handle that things. Of course, you have a anticipated work. A painkiller on that day may help you. You have a anticipated high-end work. Say, for example, a homemaker, 5-8 guests have come, so you need to run around. Or you have a function, a marriage, or some other functions going to come. One can take a painkiller. That can help for that day to work and also avoid the stress and strain. It's a simple planning which will really help it out. So in handling these kind of small contingencies which are anticipated or which may come in the way of.
So any special tips or any suggestions you have if people have to plan their holidays or their traveling?
Well, I think choose a right destination. I mean, that's the first thing which I say. I think if you have a already crooked knee or a damaged joints, I think mountain climbing is not the right things to opt first. I'm not saying they will not be able to do it. I mean, I have a good number of patients in the last 15, 20 years. They have come back to say that who are in the wheelchair brought into the hospital saying that after 6 months or 1 year, they come back to say that I climbed the Tirupati Betta, sir. So that means to say that they were able to move into that stage. But it's not in the very first beginning. In the first 1 month, he should not have take his trip to Tirupati and walk the steps. So you need to plan out the destination, and once you plan the destination, you need to plan how much energy you put in and how much stress you can take up, and based on that you can plan your participation. We need to also think as an individual that you have your people, your family. Your problem should not interfere there. That's one of the concerns which I often see the patients telling. Sir, I go with them, no, they all feel that they should also be a part of it. But you should always discuss out with them that what all you will participate, in what you will take an exemption. And so that there is a continuum in that process. In addition, as I said, the stretchers, exercises, a small pill of pain relievers will help them to plan the things.
Next question is to Dr. Pradeep. Sir, can arthritis patient, are they able to drive, or are there any limitations for their driving?
Yeah, if the patients have severe pain or badly marked stiffness, I better avoid them to drive or drive their vehicle. But if the pain and the symptoms are better, so if they are comfortable with the driving, so they can definitely drive because it's also a form of exercises, so it will ease the limb stiffness. But they also should understand that till what extent they can drive without straining their joints. So most of the people say that like 5 to 10 daily, 5 to 10 kilometers, which you usually travel for their daily routine activities. So that is accepted. If they feel a pain or a strain after traveling for more than 10 or 15 kilometers, better they should avoid those kind of the activities. So in severe joint pain and all, they better should avoid the driving as such. And also, as sir said, driving requires a prolonged sitting. So even that way also aggravates the stiffness in case of ongoing spondylitis. So if they drive for a prolonged duration, they have to take the regular nap where they can do the stretching activity and keep their spine mobile. And also they should use the lumbar seat belt, which usually given by physiotherapists. So that will keep the lumbar spine in a proper position.
So next question is to Dr. Chandrasekhar sir. Sir, a lot of our arthritis patients, apart from the chronic pain they have, the other significant thing they face is also in the form of disabilities. So they have the deformed joints, they have significant stiffness in their joints and they are unable to use it properly. So it becomes very difficult for them in terms of either they, even just as simple as dressing up or cooking or even eating food sometimes it becomes difficult. So can you give us some tips on how patients can manage their deformities and their daily activities?
Yeah, let's see, one is to limit the deformities. We normally advise them to use splints and keep the arm in the right positions and those issues. See, normally what happens is the deformities develops in the hands basically because when we rest or when we sleep, usually hands and fingers are closed like this. So now if we see that they usually deformities into that position. So to prevent that, we use splints and those things. That is with reference to prevention of the deformities. But when you have a deformities which is already permanent, because most of the time I think currently we hardly see those deformities basically because patients are approaching earlier, but we still have some patients who are misadventured here and there and come with the deformities. There we can use some of the simple attachments which can help them. For example, if someone has a difficulty to make a fist, we have a attachment which can be put to the spoon. So that spoon handle becomes little more bigger or thicker than what the small thin one. So then when it becomes bigger, a simple grip can hold the spoon. So you need a grip like this rather than a thin fingertips. So that makes them to hold the spoon easily so that you can eat things. And again, one can use a long comb attachments. So for example, if your hand is not going back, you get an attachment to which you can stick the comb and use the comb for dressing up. And similarly, there are limited changes which are required with reference to the dress you choose. So if you feel that it is very difficult to pull the sleeves, you can have the half sleeves kind of slings. And you have different designs which are available. You need to choose a right design which is appropriate for you, for depend on the deformities which are there. So these simple planning will definitely help. We have a lot of those kind of things which are available in our physiotherapy and other areas. We call them as occupational therapists, who will help us to make these handles, which in turn will help the patients to improve his functionality. So we can improve the functionality within the available deformities with some attachments and those splits. It needs a little planning. That's where I put it actually. You need it needs little more ingenuity to how to handle these deformities or disability into that. So it's like using a straw if you want to pull out the liquid from a hole. So you need a correct perfect straw based on the length. And so that's how the planning, if it is done. Even with the disability and deformities, you can enjoy the life in full.
So Praveen sir, talking about the assisted devices, a lot of people also have deformed foot also. So are there any special shoes or any other devices that can help them with their mobility?
Yeah, for a patient who has a heel pain, especially in ankylosing spondylitis, we will advise the MCR, that is microcellular rubber or MTP slippers, which are very soft, and that will that feel better with those slippers. And there are also insoles shoes are there, so they will modify accordingly with the curvature of their foot. So they can customize their shoes with a cobbler. So accordingly they can use it so that they will feel more comfortable and have a grip on the grip whenever they walk.
Do you also recommend like sticks or frames?
Yeah. Who has basically joint pain and the knee pain, and we also have knee caps for osteoarthritis. So that will also decrease the weight load through knee joint. Also helps to keep them mobile, which is very important in rheumatoid arthritis patients. So those are very helpful for their mobility.
Thank you. So my final question to Dr. Chandrasekhar, sir. Sir, sometimes the arthritis can be kind of a very lonely disease, we can say. Sometimes patients are tired all the time, so they're unable to carry on with their work, or they just have that fear of future or anxiety, or sometimes they can go into depression because they're unable to manage their activities. So, any words of advice would you like to give them in managing their psychological stress?
No, I think we need to remember a few facts actually. We all love to have a life without much hindrance or without much problems, but it's not always the truth. So there could be one or other problems, philosophically to approach that. There could be one or other problems, but that should not make you to a life. The life is precious, as everyone say about it. And for us to lead a life, what we need is what we call as a normal life. See, even if you really watch in the street, you can see that there are people with single limb who can bicycle. So it's not that he has left his life all throughout. But you, on the contrary, you also see another person with a little limp or a little small break in the arm begging for his life. That's a huge difference there. So what makes you is to personally feel that, yes, I can make it. That makes a huge difference. And there will be pain, there could be little pain and discomfort here and there. There now, with the recent advance in the science and recent advance in the technology, most of these diseases can be very well tackled. What we used to call a painful end disease, rheumatoid arthritis, 100 years back, is now completely treatable and manageable. And the objective with which we used to treat the disease, rheumatoid, 20 years, 30 years back, was to relieve the pain and keep the patient pain free. From there, now we have moved into a state where we talk of remission, getting the disease out of him for a longer time. And the deformities which I used to see 20 years back is almost not seen. I think recently when we were looking for the deformities, hardly 5–10% of them have a deformities. So that being the case, I think losing hope is something which puts you lonely. So there are ways to circumvent the pain, there are ways to get out of the pain, which we discussed at length in the last 10 minutes, and make things easier and look positively, and that itself reduces the pain.
So thank you very much, Dr. Chandrasekhar and Dr. Praveen, sir. So we have discussed about how we can handle pain in day-to-day activities. So any further questions, any further concerns, always talk to your doctor and discuss about your problems. So with this, we end this session. Thank you.